Without community health care, Pierce County would have a big void.
Pierce County would suffer, and it would affect everyone else in our community.
We'd see a dramatic rise in the number of students that have precarious health issues.
Would have a huge impact to our emergency rooms. There would be no place for people to go.
Without community health care, my family would be struggling.
You know, Pierce County's a better place because community health care has been here. They knew you had to have health care. You have to be healthy in order to be a productive member of society. You have to be healthy in order to raise your kids so that they will grow up and have the greatest potential in life.
Without community health care, Pierce County would have significantly less access to affordable health care by the thousands of patients that come here and the tens of thousands of visits that we do every single year. And I don't know how many countless medication fills that we do through our discounted and affordable pharmacy. A lot of people would have no access to the health care that they need.
They can live day to day and operate in the society and be able to contribute to the society in an effective manner with good quality of life.
It's important to my business that our community is healthy because my employees are then happy and healthy. To make sure that my employees are present at their job and doing what they need to do and are not worried and concerned about what's happening at home with their children or their families.
I think community healthcare impacts the community in hundreds of ways, but maternity support services specifically has a huge impact on the pregnancy outcomes for women in our community who are marginalized, who don't tend to get access to services, who have all kinds of complex mental health and medical problems that we can address that wouldn't otherwise be addressed. And that all benefits the community at large because those kiddos are going to be in our public school system, they're going to be in our healthcare system. And if we can get them off to a good start, then it benefits everybody.
As an ER doc, what I see as a result of lack of access to care is tragedy. The reality is when people don't get care, they don't come and see us when their diabetes is a little uncontrolled. They come and see us when they're in coma, when they're in renal failure, or when they're having that big heart attack that claims their life. Community health care is there to provide medical care, behavioral health, dental, and so much more to those that otherwise wouldn't have an opportunity to live and thrive in our community.
In order for you to do well at school, you have to be there. Untreated asthma, untreated diabetes, untreated allergies. The list goes on and on about those things that impact students. So we know if we're going to have an impact on attendance, and not only that, but focus. If you're going to have good, solid social emotional growth, you have to feel good. We all know that. And so we're totally aware that if we're going to reach our goals for graduation and reach our goals for students being performing at their best level, then they have to be, their bodies have to be performing at their best level.
And it is quite upsetting to see not all my children are making it. And many times it's because their health issues haven't been met and they don't learn.
She and I are like a team for my health care.
I mean, this is a smile that I never saw in the beginning. You know, like she has a good sense of humor, so she would joke around a little bit. But I didn't really get to see her full smile until, you know, a while later after she worked really hard to work for somebody that really is putting that much energy into their own health care. To go home smiling, I get this hit of this is why I come to work.